Thanks everyone for joining us here. We're here We're here this afternoon just to give yet another update on where we are with the COVID-19 outbreak that we see not just nationally, but more specifically here within the state. We want to allow people the opportunity to ask questions and again, update folks on data, what we're seeing out there. We're here today with Dr. Chan and Beth Daly. They've been doing an incredible job. The entire team, frankly, within public health and health and human services has just been literally going 24/7 on this over the last 2 or 3 weeks, and we can't thank them enough for their help, not just here at the state level, but communicating at a local level, working with schools, working with everyone from long-term care facilities, private businesses, whatever it might be, really making sure, again, that communication and coordination is out there so that we can really get the feedback about what we're hearing and making sure that we're being responsive with as clear of a message as possible, procedures, protocols, best practices. I think right now what we're going to do is turn it over to Dr. Chan, who'll give an update, and then we can come back for questions. So, Dr. Chan.
Great, thank you. Governor, thank you very much. We wanted to just provide an update to the media and the public around the situation involving coronavirus disease 2019 or COVID-19. Currently, globally, there are more than 118,000 cases of COVID-19 that have been identified, including now more than 1,000 cases in the United States. The public health laboratories in the last 1 or 2 weeks in Concord, New Hampshire has brought on testing capacity for COVID-19. We are working to rapidly increase that testing capacity so that we can identify people that may be in our state and presenting with signs and symptoms of infection and risk factors so that we can rapidly identify and test those individuals and do our public health investigations, which Ms. Daly is going to be talking more about. To date, we still have identified only 5 individuals in New Hampshire with COVID-19. 2 of these individuals had identified risk for COVID-19 exposure, including travel to Italy. The other 3 individuals are known and identified direct contacts to someone with COVID-19. So there has not been broader community transmission yet identified in New Hampshire, despite our increased testing efforts. As of this morning, we had tested in the last couple of weeks approximately 80 individuals in New Hampshire, and have only identified these 5 individuals with clearly identified risk for COVID-19 infection. We are continuing to work with our healthcare providers who are on the front lines to make sure that they have the appropriate resources to be able to rapidly identify, sample, and test people that or patients that they may be concerned have COVID-19, and we will continue to work very closely with them. We understand that there are challenges with patients calling with concerns of COVID-19, and we are working to develop solutions for the difficulties of testing large numbers of people who may be concerned in our state. I do want to stress and emphasize, however, that we have not yet identified broader community transmission of COVID-19 in New Hampshire. We understand that there's a lot of community concern out there given the rapidly evolving global epidemic. We want people to feel empowered to make decisions to protect their own health. We certainly do not want people to live in fear or panic or anxiety. So we want to provide accurate and up-to-date information on a routine basis. And make sure that people feel free to go about their daily activities, attend school, and other important activities, and not be in fear of their health. So when we have more up-to-date and actionable information, we will share it. But again, currently there are only 5 individuals in the state with confirmed or presumptive positive COVID-19 disease. And we will continue to work with our healthcare providers and partners on the front lines to address the ongoing questions and concerns that are out there. I do want to make 2 additional points before handing things over to Ms. Daly. The majority of people that develop COVID-19 infection will develop more mild disease and not require hospitalization. But there are those individuals and populations who are at higher risk of adverse health complications or adverse health consequences from COVID-19 infections. Those include people that are of an older age, so people 60 years of age and older, and people with multiple medical conditions, including people that may have diabetes or heart disease or chronic lung disease or people whose immune systems don't work properly. It's critically important for these individuals to be taking extra precautions as we respond to the threat that COVID-19 presents both in New Hampshire and around the globe and nationally. So we want to make, we are taking steps within the Department of Health and Human Services to work with those communities, for example, individuals in long-term care facilities or assisted living facilities, to make sure that they are appropriately protected. We want people that are out in the communities to be aware of the increased risk that COVID-19 may pose to their health if they are in one of these higher risk groups. And specifically, we want to talk a little bit about travel and the risks of travel. We have asked everybody to monitor the Centers for Disease Control and Prevention travel advisory or travel notification website. This is important for all individuals to do who are considering travel both domestically and internationally, but particularly important for those individuals who may be at higher risk of complications from COVID-19. The risk for being exposed to COVID-19 is no longer confined just to those countries that might have a CDC level 2 or 3 travel advisory notice. And so we encourage anybody that is considering travel, especially with spring break coming up, to pay very close attention to what is happening globally around the world in different countries before making decisions about travel. Consult with healthcare providers before traveling, especially if you're in one of these higher risk groups, so individuals that are over 60 years of age or people that may have multiple medical problems, and potentially even reconsider travel or postpone travel given the rapidly changing global epidemic of COVID-19. Individuals that do travel internationally need to be aware that given the rapidly changing situation, they may face difficulties returning from travel, as we have seen in countries like Italy, where there are now restrictions on movement and travel that have been put in place. And if individuals come back from international travel into New Hampshire, the situation may have changed where some of these countries may be elevated in risk and require self-quarantine for asymptomatic travelers upon returning. So just a note there about the increasing global risk of travel relative to COVID-19, and that anybody thinking about traveling needs to pay very close attention to what's happening in countries and places relative to their travel itineraries. Again, we have relatively few cases identified in New Hampshire of COVID-19, despite the increased testing that we're doing. We want to try and keep it that way for as long as possible, and so we will continue to work with our local and state partners to be able to rapidly identify if and when COVID-19 becomes more widespread in New Hampshire. Part of the work that we're doing to accomplish that is our routine public health work that we have years, if not decades, of experience conducting and responding to these types of infectious disease threats. I'm going to hand things over to Ms. Daly, who's going to talk a little bit more about our public health investigation process and how we conduct investigations to rapidly identify people that may be infected and identify people who are at risk of infection so that they are not out in public settings and posing a public health risk. Thank you.
Good afternoon. My name is Beth Daly, D-A-L-Y. I'm the Bureau Chief for Infectious Disease Control at the State Health Department. So we continue to receive reports from our healthcare provider community as well as reports from citizens who are concerned about COVID-19. So I thought it would be helpful if I describe our process for investigating any potential cases here in New Hampshire. The investigations that we conduct around COVID-19 cases are called contact investigations. This involves collecting comprehensive information regarding the patient who has COVID-19. This includes medical information such as symptoms, onset of illness, names of close contacts, and then also their locations where they've been during the time of their illness. These investigations are conducted by trained disease investigators. First, our disease investigation staff will conduct a comprehensive medical assessment working with the healthcare provider. So that involves collecting all of the medical information. Next, they'll contact the patient, and they'll conduct several detailed interviews with the patient. These can take up to an hour, potentially multiple hours, depending on the level of detail they need to collect for the individual. Some of the patients that we've conducted investigations on have been in quarantine the entire time of their illness, so those are obviously much more simple investigations and there's less information to collect. Whereas, as you're aware, some people have had exposures out in the community, and those are more detailed and complex investigations. They're lengthy and detailed, and they would cover all activities that the person participated in, both inside and outside of the home. What we do is we identified the period of time where we believe the patient would have been infectious, and then we identify any people that person came into close contact with, and that is defined as coming within 6 feet of the person for a prolonged period of time. We then use this information to notify those individuals who came into close contact with the person so that they are aware of the exposure, and we instruct them to stay home and monitor themselves for any potential illness. That way they can seek out healthcare very promptly in very close coordination with us so that we also can make sure that they are tested appropriately and that they don't expose any healthcare workers or patients in the healthcare system. We routinely conduct these types of case investigations at the health department. This is a routine activity of public health. We conduct more than 8,000 case investigations each year for a wide variety of different types of infectious diseases. And our team in public health is hard at work carrying out these core functions of our public health activities. So we want all of you in the public to do your part as well by heeding our advice around prevention of all types of respiratory illness, including COVID-19, and especially to make sure that you're staying home if you're sick. Thank you.
Thank you. This time we can open up. We can open up for questions if folks have questions.
If someone wants to get tested for COVID-19, can they?
So the question was, if someone wants to get tested for COVID-19, can they? And the short answer is that we're rapidly working to increase our capacity. It's not only the public health laboratories in Concord, New Hampshire that can do the testing. There are numerous reference laboratories around the country like Quest and LabCorp, which have brought on COVID-19 testing. And so there are other routes aside from the public health laboratories that can do the testing. It requires a provider assessment, though, and order for testing.
Follow up to that, Dr. Chen. If someone wants to get tested, I mean, is there any reason, if someone's coming down with a cold, at this point everyone's going, I have COVID-19.
Yeah.
Is there a reason for people to fear, to feel like, oh my goodness, I need to be tested?
That's a great question. The symptoms of COVID-19, the primary symptoms that have been reported are fever and signs and symptoms of lower respiratory tract illness, including cough and shortness of breath. These symptoms, however, can mimic many other types of infections like flu or other viral respiratory illnesses. And so we are aware of many people in the community who have developed these very common symptoms and have been concerned for COVID-19 and have requested testing. And that is putting a burden, we have heard, on our healthcare system, emergency departments and doctors' offices, who, if there is testing done or sampling done for COVID-19, it needs to be done under appropriate precautions with appropriate personal protective equipment. And so we want to try and preserve the PPE, if you will, the personal protective equipment, as long as we can for those who are at highest risk for COVID-19. And so my recommendations for people in the community would be is that if they don't have any specific risk for COVID-19, meaning they haven't traveled, they're not a known direct contact of someone with COVID-19, and they have more mild, for example, upper respiratory symptoms of a cold, such as runny nose, sore throat, that they should simply stay home until they're feeling better, and if they are feeling feverish, stay home until they're afebrile, meaning without fever, for at least 24 hours. Certainly if someone's symptoms worsen, they should be in contact with their healthcare provider. But for those who are at low risk of COVID-19 exposure and have only mild symptoms, those individuals we are not recommending necessarily undergo testing, but simply stay home and out of the public places until they're feeling better, which is the general recommendation for any type of illness, whether it's flu or many other viral respiratory illnesses. Thanks.
Dr. Chen, do you have any concerns regarding the number of supplies or lack thereof that are available to hospitals?
Yeah. So when you're talking about supplies, you're talking about test kits and masks. Yeah. So this is something that we're closely monitoring, and I might let Ms. Daly comment. But we're certainly working with hospitals to make sure that they have access to appropriate supplies like swabs and sampling kits to test for COVID-19, as well as personal protective equipment like masks and gowns and face shields and masks. We are aware that some healthcare facilities have these in short supply, and so we are closely monitoring this and are working with the Centers for Disease Control and Prevention and our federal partners to come up with strategies for how healthcare partners can try and conserve these important supplies. And if needed, there's potential access to some of these supplies at a state or even federal level that we could always request. I don't know if you have additional comments. Okay.
Governor, this morning when you were on our air, you mentioned disease modeling. Are there any details of any forecasting that the state has done that you can share so people have a sense of what you're expecting?
Well, so I can say that I've spoken with other governors in other states that are looking at various models, and one things that we discuss are all the different levels of modeling. No one really knows how fast this is potentially going to spread and what where we're going to be 2 or 3 months from now. I think most people understand that it very well could get worse before it gets better, but we're not in a mode of panic. We're still in a low risk state, but we are just looking at all the different those avenues, whether it's how it could infect something very local like a long-term care facility, how it could spread through a school. Again, we know that, I guess the good news here is that it doesn't look like it affects children at the same level and rate that it affects the elderly, but at the same time they can very well be carriers. And so we have to understand that you still have the ability for it to spread throughout a school, even though a lot of the kids won't experience a lot of the symptoms. So those are all just the kind of those modeling pathways. We've seen a lot of extremism and kind of panicked type models that again, I think most people are not subscribing into. They're really looking from a state and local level in terms of how it impacts a lot of the areas where you see the highest ability for it to spread, whether it's a conference, long-term care facility, a tourist destination, things of that nature. And so, again, we're providing those mitigation efforts and the best process and protocols for those folks at that localized level.
Just to follow up on that, so in terms of the modeling, you haven't figured out, estimate how many potential cases there could be in New Hampshire?
I don't think anyone's figured that out. Again, it's viral. It seems to be more contagious. I mean, I don't want to step on Dr. Chancellor, the expert here, but at first blush, it seems to be more contagious than the average flu. It appears to have a higher death rate than the average flu. Everything we've been hearing out there, a lot of the numbers that you're hearing in the public are the same numbers we're looking at internally. I mean, that's one question I get a lot. Is there something you're not telling us? No, absolutely not. What we're discussing on a national level with other governors, those numbers are very similar to what's already out there in the public. I think everyone understands the importance of being very transparent about the data, being very, very transparent about what we're seeing. Again, it just allows for that reaction to happen better at the localized level.
Is there guidance out there for bringing an elderly person into Dartmouth-Hitchcock, say for a routine medical appointment in a week or two?
You mean in terms of certain precautions that people should be taking for coming into the healthcare setting?
For the time being, I don't know.
Yeah, so we certainly encourage people to maintain their routine healthcare visits. There's not a reason to avoid the medical system. Certainly, if people need medical attention, the medical system is there. We want people to be able to maintain routine health appointments to do preventative care, essentially. There is not a risk, we believe, for patients going into hospitals at the time being to places like Dartmouth-Hitchcock Medical Center or other hospitals. We have been working with hospitals so that if someone does present with symptoms, respiratory symptoms or fever, that they're appropriately managed and not, for example, sitting in a waiting room exposing other people to whatever the virus is, flu or many of the other viruses. So we certainly encourage people to maintain their routine daily activities, routine healthcare appointments. Certainly the medical system is there if someone becomes ill and needs it. If someone has questions or concerns about their health, maybe they're experiencing some symptoms of fever or respiratory illness and think they might need to be checked out, we simply ask that they call ahead to their healthcare provider or the hospital to let them know that they're coming, so that appropriate precautions can be put in place and so that other people in the waiting room aren't exposed.
Does the state have a plan in place, probably, for organizations that are, say, having an event and then they have to ask the question, should we hold this event? How's the protocol, or do they contact you, and what are the advice you might be giving now?
So thank you for that question. So broadly, we have not made any recommendations for organizations to cancel events. There are very nice guidelines on the CDC website for event planners, and they have lots of considerations for you to take into consideration as you're planning your event around messaging your attendees not to attend if you're ill, making sure that you have plenty of hand sanitizer or at least stations for hand washing, making sure that there's adequate bathroom facilities. So doing that pre-planning ahead of an event. In terms of canceling events, CDC just came out with new guidelines yesterday that provides guidance to state and local health departments around when we might consider making those types of recommendations to our communities. And it's really a phased approach based on the level of transmission, community transmission that's happening in your area. So here in New Hampshire, where we have the 5 cases and we don't have sustained or widespread transmission in our state, we are not at a point where we would be making those broad statements for school closures or canceling events. And so we would encourage any community or organization that's considering making those recommendations to please reach out to us before you cancel events or close your school or anything like that, because we want to have that consultation with you, because those are not recommendations that we're making yet broadly at this point.
What about in these large groups? What about people who are at higher risk of developing COVID-19 and large events like we have, like high school basketball and hockey tournaments this weekend? Should older fans, grandparents consider not going to the game?
Yeah, I think that's a great question, and one of the questions that's being asked and talked about at a national level, because of the risk that the increased risk that COVID-19 poses to people that are of an older age or might have multiple medical problems. I think these kind of decisions happen both at a local level based on the level of transmission in our communities, as well as at a personal level, people's comfort with being out in public and their understanding of their own health and their willingness to accept health risks. Given that there is not widespread community transmission identified in New Hampshire, we believe the risk to the general community, including individuals that might be of an older age or have multiple medical problems, we believe the risk in New Hampshire remains low. Now, that could change, and we will reassess the situation as this global epidemic progresses, as we do more testing, if we identify additional cases, which is very likely. But right now, again, as Ms. Daly mentioned, there's not a recommendation that people need to cancel mass gatherings. There's not a recommendation that people of the older age group or with multiple medical problems need to avoid these public settings. But that's definitely a consideration. We would encourage everybody, knowing their own health, talking with their healthcare providers, to make these kind of decisions on an individual level based on their willingness to, be out in public and potentially be exposed not only to COVID-19, but flu, which can be fatal and cause serious health problems in people who are very old or even very young, or people with multiple medical problems. So I think the recommendations for how people protect themselves are very similar to these recommendations we put out every year around flu prevention. It's not to avoid living one's life. It's not to avoid being out in social settings, but people need to be out with the awareness that there are viruses circulating, and to take the appropriate social distancing steps to protect oneself, avoiding close contact with people that might be coughing or ill, practicing frequent good hand hygiene, avoiding touching the eyes, nose, or mouth after shaking someone's hand or touching a doorknob, because you can transmit a virus, any virus, through the eyes or the nose or the mouth by through the hands. So I think some basic steps like that will go a long way in helping to protect people's health.
Sorry, I'm late. Ethan DeWitt, Concord Monitor. Just to follow up on that, so you said multiple times that it's not the time yet to consider shutting down some of these larger events. That's not a recommendation you're making, given the situation right now. what is the threshold moment when the state does decide that? And I guess what I'm thinking is, is there a risk that threshold happens too late, in that, the risk may not be there now, it may be there in the future, but by the time the guidance is given, yes, please stay away from sporting events, yes, don't gather in large groups, it's got to the point in the state where there could be more people infected who didn't know that ahead of time.
Yeah, that's an excellent question, and I think that's part of the reason we're trying to increase testing throughout the state, so we can identify if and when it becomes more widespread. And those kind of decisions are really made on a case-by-case basis, community by community even, based on information we're getting from those test results, but also from what we're seeing throughout the rest of the country. I'm going to see if Ms. Daly has additional comments.
So thank you for the question. I think when you look at the CDC guidance around this topic, I mentioned it's a phased response. And so we right now are in the lowest category, where we're not recommending broadly to cancel events or cancel school. But there's a number of really important actions that we can all be taking right now to prevent reaching those higher levels of community transmission. And they're really critical, which is why we keep saying, please stay home when you're ill, because that's how transmission will become community transmission, sustained transmission, is if people go to the large gatherings that might be happening now while they're ill, or they're going to schools while they're ill, going to work while they're ill, and that's what we don't want to happen. And so we keep asking people to help us all by not doing that. And so we want to follow those guidelines, because we don't want to disable our society when it's unnecessary, right? And it's not helpful. And actually, there's an evidence base around these actions. They're not just made-up recommendations that people sat in a room and looked at, when should we close schools? And I know that there's a lot of pressure on our communities and the event planners in the schools to feel like they need to protect their communities, which is very noble. And so they're like, I'm just going to be the most protective I can be, and I don't know what to do, so I'm going to close today. But actually, there's an evidence base behind these recommendations. They've actually looked in prior pandemics and community transmission globally to see that, look at when it was most effective to close schools and when it wasn't. And there are certain points where it is effective and where it's not. And we want to make sure that we are using an evidence base when we make decisions in public health. So,
my follow-up, and apologies if this has been asked before, but has anyone asked about the legislature specifically? Given risk factors of age, there has been some discussion today among lawmakers of doing something remote voting, and there's been some questions over how viable that is. What's your take on that, Governor?
It's a decision for the legislature. The legislature has their own rules. There are 400 of them that sometimes sit in a room all together. Some of them are elderly, of course. And so, my sense is that Speaker Shurtleff is taking all that into consideration, talking to a variety of different folks. But I can't answer it for the legislature per se.
Correct me if I'm wrong, I think that the CDC said people 60 plus should not be getting on airplanes. I look at the House of Representatives, and I look at the seating, and it's not too different from an airplane setting to me, but I could be wrong. I just wanted an expert.
Yeah, sorry.
Yeah, so I think that that can apply to any large mass gathering, which we've tried to address the concerns around that already. Traveling through an airport, though, is different in many ways from attending a local basketball game or the local legislature, where the majority of people in that gathering are locally, live locally from local communities. So certainly I think that the comments earlier apply, but also, you're correct that people that are 60 years of age and older, people that might have multiple medical problems, are at increased risk of health complications, not only from COVID-19, but from many infectious diseases out there like flu and other respiratory viruses that can cause serious illness. And I think the focus needs to go back to the everyday common steps that people can take, as Ms. Daly has previously mentioned, as I've previously mentioned, about protecting one's health, and people that may be ill staying home to protect other people's health. And certainly, if and when we identify wider spread transmission, and we're out there testing, we want to know when there's wider spread community transmission in New Hampshire. We will adjust our recommendations accordingly to try and protect individuals in our communities, and that may at some point in the future involve recommending against mass gatherings or community events, but I don't think we're there yet.
To what extent is the state interacting with local hospitals around capacity issues? Should this get worse, number of ventilators available, down to numbers of masks, and this part of the question may seem ridiculous, but we received an email this morning from New Hampshire Public Radio saying that they understood that the state was, whoever sent the email was having a hard time acquiring appropriate masks, and so was ordering bandanas. Like, can you comment on if that is true, first off? But I mean, to what extent describe the interaction between the state and healthcare providers and hospitals in terms of making sure that the capacity is there should this escalate?
So the department works very closely with our healthcare providers. They're the front line of our public health system. We work closely with the New Hampshire Hospital Association as well as the Granite State Healthcare Coalition, which is a statewide healthcare coalition, which is specifically funded to do exactly what we're talking about, which is to assure our healthcare system's readiness to respond to all types of different emergencies in our state. And they're actually working with us around inventorying PPE availability in the state, looking at ventilator capacity, looking at airborne isolation room capacity. So these are all things that we have been looking at for 2 decades, and we have plans around for surge capacity in the state, but also looking at current inventory and availability now as well. So we're monitoring this very closely. I have not heard the rumor that you just described about bandana use. We have reached out to all of our healthcare providers to provide them with the contact information at the department. Should they need any assistance with acquiring PPE, it would not be acceptable for us to hear that any healthcare facility in our state does not have access to PPE to protect their healthcare workers, and we will make sure that they have access to PPE. We have some state resources available to us as well as potential access to federal resources as well.
But I mean, do we know how many respirators are available in the state right now?
I do not personally have that information in front of me.
What's the public guidance again on using masks? When should they be used?
So there's no recommendation for people who are not ill to use masks. The people who would wear masks are people who are ill, and they are usually used when they would walk into a healthcare facility for testing. They should have a mask placed on themselves to prevent that spread of droplets that could contain virus.
Should people be buying them if they're not infected now?
We are not recommending that people buy masks.
It was just announced that Battle of the Badges is going on, but without spectators. Tough decision for organizers. That's a beloved event in our state. Did they seek some guidance from you all on that decision?
I'm not aware of any consultation made to our office around that.
If I can just make a quick follow-up to your question about healthcare providers on the front lines. And, public health has a lot of experience responding to new and emerging infectious disease threats like this new coronavirus. But any threat like this poses its own challenges, and really it requires a team approach to addressing those challenges and those issues. And our healthcare providers, our healthcare facilities are absolutely in the front line, and we want to support them. We are aware of the concerns around shortages of equipment like masks and gowns and other personal protective equipment. And so we're constantly in discussion with them on those shortages and issues, and we want to know if healthcare providers run out of masks, for example, because it's of critical importance to protect those on the front lines delivering healthcare so that we can continue to deliver high quality healthcare services in our state. I think this is also a problem that's recognized not only at a state level, but also at a national level. And the Centers for Disease Control and Prevention is constantly updating their guidance and reevaluating how we can best conserve the personal protective equipment so that we try not to run out. And I know that the Centers for Disease Control and Prevention just in the last day or two has updated their recommendations for appropriate PPE use, suggesting that if supplies are running low, that there are different types of masks providers can use depending on the situation, the setting. And so we're working very closely. I think the point is with our federal partners as well as our local partners to try and address these challenges and the demands of our healthcare providers so that they can safely care for patients and maintain the capacity to deliver healthcare in our state.
We've regarding quarantine investigations, if someone has breached the self-quarantine or the public health official ordered quarantine, how does that change your investigation? You have to double back then and find out where they went, and is there recourse?
So currently, we have over 200 people who are under public health monitoring, which means that we have specifically instructed them to self-quarantine at home. And due to a exposure that we have identified for them, that we're monitoring them, which means that we call them and we assess them for symptoms and confirm that they are still abiding by our instructions to stay at home. If there's any indication that they are not abiding by our instructions, we would issue an official legal order, which gives us enforcement capability through legal action through the courts and then law enforcement.
Has that happened at this point?
We have issued legal orders in our state for individuals who we were concerned about not complying with our instructions.
How many?
2. We've issued 1 order of isolation. Isolation orders are for people who are sick, and then quarantine orders are for people who are not sick but have been potentially exposed, and we monitor them to make sure that they don't ever develop symptoms, and we've issued 1 order of quarantine for COVID-19.
Okay, well, we just want to thank everyone, and as a reminder, we remain in a low-risk situation. We're definitely not a time to panic. We really encourage the folks out there, especially the public, look at the travel advisories, take them very seriously. For the few folks that we do have on a quarantine, and we're monitoring on a quarantine basis, we, again, strongly encourage everyone to abide by that quarantine. It is incredibly inconvenient. We appreciate that, but there is definitely a personal responsibility that we're asking everyone to really appreciate and take, and understand that given the incredibly contagious nature of what we're dealing with, that we can get through it. It is a matter of weeks, to be sure. Luckily, it is not a matter of months. I think some of the first students are coming off quarantine this week. I think even today or tomorrow, which is great, and there should be other folks coming off quarantine in the near future. So again, it's very new, but luckily New Hampshire still remains a state of low risk, and we want to keep it that way. So we'll keep coming back periodically with updates, just so folks, again, have the information, have the data, and understand that what we're doing here and the recommendations that are being made are truly evidence-based. And if you have questions, please pick up the phone to call. I'm just going to double check the number just to be sure. It is 603-271-4496. I just want to make sure I got that right. 271-4496. So if folks have a question or a concern, be sure to pick up the phone, give us a call, and we'll get you what you need. So thank you guys very much.